Good morning, ladies and gentlemen. My name is Vandana Bhatt and I'm the Managing Director of Hospitality Group. Today, we have brought you a live session with housekeeping professionals around the world. We will be discussing the new role of housekeeping post-COVID. So, in this live webinar, we will be discussing about redefining cleanliness and safety for our guests. So, before earlier, when you visited a hotel, you never were worried that the bed you were sleeping in or the towels you're using, the public areas, the F&B areas, you were never worried that it was clean or not. But now, since the virus has taken over, you want to make sure that when you go in any hotel property, your family is safe, you are safe, and you when you check in, you are safe, and you when checking out, you come out really safe, so that you can go back again for entertainment whenever you like. So the life has changed, and there are new normals which we have to adapt. And with with this webinar, we will be discussing with housekeeping department, housekeeping leaders, the new normal of today's life. If you remember, when 9/11 happened, a lot of people were worried about security. So a lot of technology came in, and a lot of things changed when the 9/11 happened. So now I think the security, it's all about housekeeping these days. When you enter the hotel, the moment you step in, you notice if the hotel is clean or not. Now it's not only about being clean, it's about being clinically clean. You want to make sure, like you get in the hospitals, those kind of cleaning, the safety is there. So the time has really changed, and we want to make sure that there is no virus transmission, there is no risk, and you trust the hospital brand, the hotel brand. Every hotel property, being Marriott, Hilton, Intercontinental, or any other Accor brand, all of the reputed brands have adapted new protocols and new guidelines, new safety measures to come through this thing, to assure the guests that they are, when they're checking in, their family is safe. The kids can play in the pool, they could go on the beach, and they get all the safety measures they need and they have paid for. So let's introduce the panel for you, please. On the panel currently we have Tatiana Ahmed. Tatiana is the Executive Grand Housekeeper Grand Hyatt Dubai. She is also the President of UAE Housekeepers. Then we have Paul Sade. Paul is Executive Housekeeper Marriott Beirut. Then we have Prabhat Shukla. Prabhat is a very good friend. He is the Executive Housekeeper for Intercontinental Doha and also the President of Qatar Housekeeping Association. I've been really waiting to write something on housekeeping. So Prabhat has helped me to put this webinar together. Thank you, Prabhat. Alena Miatlushka. Alena is the HR Manager, Hilton Toronto. Then we have Mikhail Korolko. Mikhail is the Room Division Manager, Novotel Toronto, North York. And then you have me, Vandana Bhatt. So let's get to our panelist for the question and answer session. Tatiana, my first question.
Yeah, okay.
Yeah. So Tatiana is the Executive Housekeeper for Grand Hyatt Dubai, and she will be answering some questions. Tatiana, my first question for you would be your perception on the future of the hotel industry and what strategies it should adopt before they start operations post the lockdown.
Yeah, well, hotels definitely will gradually reopen again. Some restrictions in place, and certainly business will slowly increase as international air travel also reopen. Now, many countries still have this 14 days isolation program in place, which if this would be eliminated, people will be more willing to travel because they don't want 14 days in isolation. It does not much sense, even for business travelers. So, but before all this will happen, like international air travel opening up and going back to normal, we are all looking forward to the local staycations this year. Because people won't travel that much, and the summer vacations are now coming up in 3 weeks. So staycations will be a very big for the local tourism and hotel industry in all areas. Then with regard to the adoption, before starting operations, it is extremely important make sure to look at the government guidelines which are being put out. We assume that COVID-19 is going to be for some more months, and we need to implement certain measures to make sure that our colleagues are staying safe the hotels. So this is starting from the 2 meters distancing to temperature checks to provide sanitizers in all areas, and also to provide sanitizing wipes in the guest rooms, retraining of the staff. All this is very important to ensure that the guest has confidence again, in coming back to the hotels. And training, of course, is one of the most important factors. While corporate offices are filtering down training, also our providers for chemicals and cleaning supplies, they have also come up with new trainings and with infection prevention programs, and along with new cleaning practices, which actually help the hotel to their hygiene plan, and that everything is in place. So yes, we do hope, that things do resume pretty quick, and that that the hotels stay busy.
Yeah, that's wonderful to know. And are you doing any special for the staff? Means when they come in, what do they have to do? Do you do the thermal checkup for them or temperature checkups every
Yes,
day before they come in?
taken, and of course, then they have to use their PPE.
Okay, okay.
Right around, even in the back of the house, and of course social distancing be practiced all the time.
All right, all right. Thank you so much for that. Next question would be for Elena. Elena, what elevated processes and team member training programs would you have you planned for better and safer stay for the guest? Do you plan with external agencies specialized in hygiene and safety products for such trainings?
Mhm. Globally, Hilton is partnering with Reckitt Benckiser, more known as RB, and
Mhm.
Mayo Clinic as well, to develop elevated processes and team member training to help Hilton guests to have a safer stay. Clean Stay is the program, and the Clean Stay with Lysol protection will be a rigorous system that incorporates RB's trusted scientific approach to cleaning practices and product offerings, as well as the experts from the Mayo Clinic infection prevention and control team, helping Hilton in rewriting its cleaning protocols to translate the best practices of hospital hygiene standards to hotel
Okay.
guest rooms.
Wow.
Medical experts also will advise us on the new technologies and approaches, assist in training development, and create a rigorous quality assurance program. I think also that every hotel needs to have, at the very least, to have a few policies or the practices and training in place related to hygiene and sanitation, screening, physical distancing, PPE, for example, like travel and the contact logs. Infectious disease as well, generally, and related to COVID, of course. If not already established, you should have an infectious disease or COVID policy, which sets up the process and reporting obligations as well if an employee has a suspected or confirmed case of COVID, and others, of course, based on the market where you operate.
That's wonderful to know, actually. Mayo Clinic, stepping up and helping the hotel staff, training them, with the hospital standards, that sounds really good. Maybe other countries can adapt that also. And they can also train now the hotel staff. And I believe that housekeeping professionals are such warriors these days. They have to make sure they stay safe while they are taking care of the guests. And, it's a big responsibility on the housekeeping department, actually. So
Absolutely.
that's very, very important. And I think my next question also will go to you. What are the challenges that the learning and development would encounter in the post-pandemic times?
Mhm. If I speak from the people standpoint, during these times, leaders, obviously those who were working, they became more accommodating, and they should stay this way, because our team members rethink what they really want from work and life in general during this lockdown. So their priorities may have changed as well. Our housekeeping leaders, any leaders working in hospitality, they need to be consistent and have an intuitive approach. They definitely need to be equipped with the skills, with information, first of all, and skills like the coaching skills and problem solving skills, but based on the pandemic real life scenarios now. Another thing that I can think of and can suggest to any hotels to introduce the reboarding. It's like the onboarding for the new hires, but then it's for the people who will be recalled back from the layoff or the leave of absence. So make a new experience for them. First of all, communicate a recall date to team members well in advance. Written notice is the best practice for all employers and should include the recall date, any adjustments to the working conditions, and the health and safety procedures or the measures. Like, for example, health screening on the entry, right? Or the PPE requirements. Provide all the necessary information like the new policies, protocols, maybe the new job descriptions. I think it's the time, for us to revise and adjust the job descriptions to the new norms.
Yes.
Maybe videos with the new cleaning techniques that they can watch beforehand, before they come back to the hotel. Organize a virtual class, like, for example, the supervisor or the manager can speak new norms to the colleagues before they come back to the hotel, right? Give them all the theories, new practices. And then on the first day when they're back, focus on the on-the-job training in one-on-one or small group settings. And I think, as Yuvangana mentioned already, yes, indeed, our housekeepers are the frontliners, right?
Frontline warriors, yes.
Warriors, exactly. So constantly talk to them, talk to your room and the public area attendants, speak to your laundry personnel as well. Ask them what works and what doesn't work, because they're the ones who are practicing the new protocols, right? And then obviously make an adjustments based on their feedback.
Right. Okay. That's wonderful insight.
Vandana,
Yes, please. Hi,
I
Prabha.
will just the same because
Sure.
of what happened. All of a sudden, 360-degree changes came for the housekeeping job.
Of course, yes.
The housekeeping was like a layman's job most of the time.
Of
when
course.
we are hiring, now you have to have people who are technically expert, because from the aesthetic clean, you are a clinically clean. And hats off to everyone, because the people who are there, especially I'm saying the room attendants who are not technically trained right now doing a hospital job.
Yes.
Because there are no education of those norms who are being trained right now to them, and they are doing is a big kudos to them.
Big responsibility.
The time when now we are hiring a person, we have to take care of, like initially what happens is when we are hiring the people and somebody, especially in the Middle East, when they are coming an aspirant as a reception or an aspirant as a waiter, and you found the person have a potential but not very technically sound, you put in them a housekeeping. But now you can't get it done that easily. You require people who knows the chemical, the concentration, how to handle it up. It's much more like a hasap. It's going to be.
Yeah, interesting.
The new dynamic which will be changed.
Do you think there'll be new certifications for that now?
Very true.
Yeah.
Coming up. Because as Elena said, Mayo Clinic in IHGB with Cleveland, many properties are coming up with the different clinics and partnerships. So everybody is going through a new learning and understanding it up.
Of course.
Now, it is, as you said, front warriors, but they are more technical now.
Technical, yeah. It's not like before anymore. It is never. It's like, I don't know when we can come through the same situation like we had before. It's all different for all of us now, and I hope everybody has to get used to, like we are doing virtually right now. No conferences, nothing is happening. So thank you to all the housekeeping department, actually. Doing wonderful job. Yeah, my next question will go to Mikhail. Mikhail, do you forecast any paradigm change in the guest service design from the point of view of hygiene and safety? How would it be disseminated amongst the staff? If you can answer for me. Yeah.
Absolutely. Thank you, Vandana. Also, just to build up whatever Prabhat and Alona just said, yes, we absolutely don't have coming back to no, back to normal. We're creating a new normal. Also, me working at Novotel as a part of a core brand, a core partnering with Bureau Veritas and John Hopkins Institute and the university with
Okay.
Dr. Ruth Patran, senior
Mhm.
scientist in public health and infectious diseases. They
Okay.
created a special guidance for us, which we're implementing together with Ontario and Toronto government regulations. And we have to create a new paradigm. So what we're going to do from the perspective of the guest service. First of all, our core created a 48 hours rest period. So it means when the guests check out from the room, we're not cleaning it right away. We put it carry over for 48 hours. Even some studies showing that virus can survive up to 7 days in certain surfaces, but majority of it will die within those 48 hours. The next step, it's going to be a special deep cleaning and disinfecting. And there we have to, as Alona said, maybe readdress the productivity standards for room attendants because it might take longer time to clean those rooms. Also, in terms of the stayover service, we used to provide it on daily basis to our guests, sometimes even turn down service twice a day for luxury properties. Now, our core recommendation that we do clean stayover rooms only third day and just a wellness check every day in case if the guests need any items to be brought up to the room. And even with those items, I see actually that guests requiring less requests for the special on-call items, such as toothbrush or like shaving kits, because they might prefer to use their own items. Or if they want to have any special amenities to be delivered, it has to be make sure that it's a clinically clean level and safe to use. And in that terms, we're actually coming back to taking a step back. What do I mean by this? As you all know, all the hotels, all brands participated in different green programs with the main focus eliminating the plastic and switching from individual amenities to the bulk refillable options. Unfortunately, now due to the situation, we have to come back to individual or sealed wrapped or plastic wrapped amenities. So this is what we have to do, right? Also, another step and paradigm when I might see, even for the public areas, the guest might prefer to use luggage carts and use their own luggage instead of using the bell service, less contact with another person. So we all have to address this. Certain changes with the public areas, gym, pool, lockers, how the public area attendants going to be more frequency cleaning, make sure they use the special products. We actually, again, with our property, we switched to all touchless dispensers for hand sanitizers, touchless dispensers for the towels and the bacterial soap, touchless faucets. Everything is touchless nowadays. We don't want to just, or if they still have to touch certain points like switches or the remote controls in the rooms. Those needs to be properly disinfected with the proper products. Another thing which we want to have in mind to make sure we create a safe environment for our team to work, because you all, and that comes back how to disseminate it among the staff. We all know the happy cycle, right? When the happy employees create the happy guests become a repeated guest, and which creates more revenue and more happy guests. Now we have to look at it from safe perspective. So safe environment for our employees when they have all necessary tools, equipment, and protocols set in place to keep them peace in mind that this work they come in every day is safe to be in. That actually transmitted to our guests that they feel that they're safe to stay in this hotel, which brings them back to stay more often and creates more revenue. Again, we have the same happy cycle, but from the safety perspective. And we actually have to communicate to the guest what we're taking, what measure has been addressed and how it has been addressed, to show them that we actually do care about them. For example, Accor created a special website, allstaywell.com, and we all the whatever the items we bring into the room, it has a special level, all safe cleanliness level. So again, we communication, education, and proper training is the key.
That's Yeah, that makes sense actually, and it's wonderful to know that you have different gaps and days before you check in another guest. Meanwhile, you can disinfect and do everything. So that's wonderful
But
insight, Mikhail. Anybody else would like to add something?
yeah, Vandana, this will be very, very interesting to see. Right now, we are making a lot of the norms of leaving the room for 48 hours or
Mm-hmm.
62 hours. But how you
Okay.
will run with a 60% occupancy or 80% occupancy? Because gradually, when we are talking about the new norms, we are
Mm-hmm.
talking about business will go up. Right
Yes.
now, it is very, very easy to make 3 sets of room, and 72 hours, we won't keep a guest over there.
Mm-hmm.
But we have to come up with the ideas where we can sell our room within 24 hours.
Mm-hmm.
Because of gradually people will start moving in.
Yeah.
Absolutely.
That
If
time,
I
how you will run with it.
Tatiana, would you like to add something in there?
Yeah, no, I think it's very important that your cleaning regime is in order, and that we know how to disinfect the rooms properly. 72 hours, 48 hours is a long time.
Yes.
I think, 24 hours, this is what the Dubai government has said now. Rooms have to
Okay.
be
Kept
idle.
Yeah.
A guest is checking in, and yeah, this is still acceptable. But I think with the programs which we are putting into place, with all the disinfection, I think this will also cease with the time.
Mm-hmm. Mm-hmm.
Absolutely,
Okay.
I agree. And also that comes to back to a question with the partnering. For example, in Ontario, the three major companies we worked in terms of chemicals, it's Ecolab, it's Cintas, and it's Diversi. What we're
Mm-hmm.
working currently with Ecolab, all the chemicals, it's actually doesn't require any exposure time. So it has instant
Okay.
kill. So it will
Mm-hmm.
kill viruses right after it's applied
Okay.
properly to the surfaces.
True.
And that it could eliminate this 48 hours, but slowly when the business is not back to normal, we follow in this guidance, but I agree with the rest of the team that it has to be readdressed when we're back to full up.
Yeah, travelers have to be assured, they have to feel safe while traveling. As you said, Mikhail, that when people come to your hotel, they will be assured that this is safe property for me, and then they can come back again and again. It's all about safety at the moment. So it's all spread of mouth. People can talk to each other, and then it will be trusted brand if once these things go on. My next question will be for Paul. Paul, housekeeping have become they have become frontline warriors to fight against the pandemic. So, what would new hygiene protocols are you planning to adopt to take the hotel from aesthetically clean to clinically clean?
Good afternoon, good morning to each and everyone. Good evening. I don't know the
Hi,
time
Paul.
now. We're
Yeah.
just going through all over the world. Thanks for everyone, actually. Mainly, in Marriott International, we have implemented a new program that will go all over the properties, all over the world. And it was announced earlier by our CEO, Mr. Arne Sorensen, which is called the New Normal for sure. There will be a very clear set of standard that it will go through every core in every job that the housekeeper will do. Mainly, we have like the support of our preferred partners, like Ecolab all over the world, and for sure there will be they will introduce new machines that will help to protect guests and to protect employees as well. Looking after the guests, preparing the rooms for to welcome another new guest. And for sure, we will go for the critical path that will go through all over the properties, step by step, all over the department, from engineering to housekeeping, front office, taking the measures of sanitizing the luggages, the trolleys, the cars, even the keys that will come back to the reception. The housekeeping will look after them. It is going to embrace all the details that the guest will look after them, and which makes the guest feeling very safe to come back and use our properties and use our rooms.
Yeah, thank you so much for that. I
Uh,
think contactless key cards and these things are in on
Sure.
now, and people are using that, and they'll be
uh,
introduced slowly, as I think. Yes.
yeah.
Yeah,
Vandana,
please.
now housekeeping is not invisible job will be. It will be more theoretical job. It will
Mm-hmm.
be like theoretical thing. Now guests would like to see people using and cleaning their things which belongs to them.
Okay.
Earlier used to be invisible housekeeping where people use no cart should be there, no trolley should be there. People come clean the room, nobody come to know. It's like a magic, but now
Mm-hmm.
people want that magic. People will be very curious what chemicals you are using, what disinfectant you
Yes.
are using,
Yes.
how you are cleaning, how you are sanitizing, how you are disinfecting.
Yes,
So
that's very
as you
important.
said, the frontliner they have to play a theatrical role now. And in that, again, as Elena said, training will be very, very key point, because the time when a boy is using something, a guest is curious, boy should reply a very, very right point to the guest.
Yes, it
Because
right with the correct information.
if the information is not right, the trust level will be broken.
Yes, definitely agree. Yeah.
I would like to add something, Vandana.
Yes, please.
Mainly when the guest will come, it is all over the hotels, all over the world. A guest would look always for, having the memorable experience. But now it's going to be engaged as well with the cleanliness, as it's going to be like a total no-go. There will be like no gray zones. Either it's clean, either it's not, and either it is spotless. So mainly the guests will look for all the aspects to come, and it will start always, when they come to the airport, going to check in, going to the elevator, clocking the room. It's all over these aspects will come with the guest, which is something very good now.
Yeah.
And as well, I mean, it was very tough, but if we remember as well as what our CEO have mentioned earlier, I mean 9/11 and the
Exactly.
worldwide crisis, they
Yeah.
were very tough, but we overcome. But
Yes.
I'm sure we will overcome
We
this
will,
one.
we will, we will together. Yes.
uh, as we can feel, really all the hotel in Qatar, in Lebanon, all over the world, they live with it. They start really practicing the cases and cleaning and having all these things, which really makes them stronger to overcome this stage.
Mm-hmm.
Back to you,
Yeah.
Vandana. Thank
Thank you,
you.
Paul. My next question is for Prabhat. Prabhat, how do you gauge the challenging perceptions of guests towards quality in the post-pandemic period? And how would you like to address them?
See, I'll say right now, as everybody is little bit confused, people are not very clear what to be done.
Of
Like
course.
when we started in March, and I have a webinar, people were on the thermal cameras and no touch points. It as if we are going to be a such movies. And gradually now we are more matured on that.
Of
Now, as
course.
I saying 24 hours, so gradually things are moving and people are understanding on those notes.
Mm-hmm.
And as I said, there is no education like an adversity. And
Mm-hmm.
in this, and like in this time when we are talking about a new norm, and everybody's a little bit anguished what is being happening. So people are a little bit more very aggrieved upon what you are getting done, the messages, but on the same time, when we are talking about everybody is getting transparent, posting their SOPs, cleaning, hygienes, so that we can communicate to the guests, informing to them what exactly we are doing. But on the same time, rather than having a no contact, I will prefer the guests would like to have a less contact or a handshake to the guest. There can be your own bespoke, something new agreed to the guest, a verbal greet. A smile should be there still rather than a robotic approach. So because at the end, when the guest is still the same guest who's spending our money, he wants to people to listen, hear a laugh, talk, have a good conversation. So that is something which they are still looking for.
Of course.
So we have on the time when we are making these standards, because of what happens otherwise is it is more robotic things. When we are getting it up, you came, got a hand sanitizer, you have your own kiosk check-in, you went with no touch payment, you came in, you entered, you got a robot with a room service. So where are the people? And that is something, and this moment, people are already frustrated, anguished, they will be more depressed. So we require people, we require to speak to them, we have to understand and make a good communication with them and explain them that, and now gradually people are understanding that we have to live with it, and gradually we will be apart from them. So it is a very, very important for us right now to explain them up and have a norms which are very, very transparent and understanding to them.
I just would like to add also on what Prabhat is saying, and Paul and Mikhail were mentioning as well. Education is the key, but not only educating our team members, but also our guests. And I think marketing campaign should be and will be based now on safety and hygiene, right? So it's time to promote and elevate our housekeepers. Make nice videos, showing them practicing new skills, right? Or, promoting the new protocols and so on. Yeah, it's time to shine now, as Prabhat said.
It's time to adapt new changes actually, for marketing, for housekeeping procedures, for the way, I think the way we have looked at hospitality industry before, the airports and, hotels. Right now, we are the worst industry to suffer. But as the human race has overcome all the earlier things before, we will do it together too. And I think that's anyone else would like to add something?
Actually,
I will. Oh,
yes, please.
Yeah.
I just want to share something. 2 years ago, Alena organized the visits from the preschoolers to our housekeeping department. And I was a little bit worried because it's a younger kids, how I can make it interesting for them. So I came out with the idea to present our housekeepers as a super cleaning heroes. But now their realities, who can imagine they're actually super heroes, and we have to present this image to our guests and make sure it's spread along.
Yeah, of course. They should see it like that. And I guess that a lot of new products will come in now. Are you guys changing the mattress also? Because I heard from somebody that the hotels are required to change the mattress or beddings or something. Is it true?
Well, I think it depends what is the condition of your mattress. But a lot of hotels already have implemented encasements a while ago, which keeps your mattress actually really nice and clean, and you keep on changing the encasement from time to time to make sure that it's fresh. So there are certain products you can have, to make sure your mattresses are protected.
A lot of new products will come in. I'm sure disinfectants and certain other things will keep the housekeeping running. How do you see the change? Are you accepting more reservations right now as the hotels are opening in Dubai especially? And what is the new change?
Some hotels are already open, and they are very busy, not only on weekends but throughout the week. And as more hotels are opening up, yes, we are very confident that the tourism bounces back very soon.
Yeah. So we are mostly, I was listening to somebody in another conference. They were also discussing this summer is only going to be in country, in interprovincial, interstate kind of tourism for all of us in any country we have. So in Canada, we are only remaining with Ontario and Quebec with higher cases. The rest of the states have nothing. The provinces have nothing. So just 1 or 2 cases. So that will go. So UAE is coming up slowly and they're opening. And India is also coming up. So we will see slowly. We'll see the hotels opening, and I am sure that. But until the vaccine is arrived, we have to start living with a new normal. We recently traveled, and sorry, yes, Prabhat.
And we have to spend more money.
We have to. This is what my next question is actually.
Yeah, one of the studies says now that we require 130,000 USD for a month. In total to spend for 250 rooms property with 60% occupancy additional. So
and this is going to the owner's cost.
this will be the operational cost.
Operations cost. Yeah.
This
So
will
the
be the
owners will be sad about that now. So new thing.
So that will be a price strategy now, gradually,
Yeah.
which has come upon.
Yes. Because
And
thermal
as we
detectors and everything has to be bought.
very true. As everyone says that right now, as Steve Jobs said once, that everyone has a sense that right now we are at the moment when everybody is that influencing the world for the future. And with the effect, what we are doing right now on this COVID-19 with the strategies and the moments, I'm very particular that we are going to change the future
Of
of the
course, we
housekeeping.
have to. There is no choice. I would say there's no
Yeah.
choice. We have to do it. We have to live, and we cannot. We are humans. We have to see each other. We have to, meet in person, and slowly, even if they allow with a mask and everything, we have to go and start our new normal soon.
Very
Dubai has become 100% operational right now. The offices are open, and people have started going to work. Canada is still coming up. There is stage 2 being announced today, so that will happen. And slowly, I think the other countries are getting used to it, the new normal.
Yeah.
I think we are all set. Let me see if anybody has any questions we can take. Prabhat, they're saying you touched very important. Okay, there is a question from a person here. Is there any plan of displaying HK work or process to guests in lobby or on hotel website to build more trust?
If I may,
Okay.
could I? Okay, so yes, for us, we are updating the information on the website, and also what we're doing now, we're actually sending to each upcoming guest a special welcome letter by email, stating what has been done and how we're addressing those issues and what kind of service they can expect. We don't want to overshare, of course, but we want to state the key points and maybe to provide the information what we're doing to make sure that.
So everything is available on your website?
Absolutely right. Yes.
In
All
most
the
of the
information.
hotels.
Sorry?
Every hotel chain. Yeah.
Yeah, I think I'm most impressed with the John Hopkins and Mayo Clinic stuff, like they're training the medical staff. I think the hotel should come up and they should tie up like they're doing in North America. They should do it in other countries also, and the hotel should be taking training now from the hospitals. So that's why they'll be clinically clean. So 1 minute, I'll just say, what will it take for a revival of the hospitality industry?
If I may answer.
Yes, please.
Mainly, in my own perception, there has to be a study. I mean, for the upcoming 6 months, at least for each country, for each place, and it might take from 5 to 6 months as it will grow up gradually. As far as I know, it is actually started. It's not bad for now. With the pre-opening, but it will grow up gradually from property to property, from country to country, I believe.
Yeah. There's another question somebody has asked. They're saying about linen actually. What will be the next step in linen per management post-COVID? About the linen.
Yes, I can share what we're doing. We outsourced with our linen services, and we're using the K-Bro company, which is international and most fast-growing company. It's now operating in Canada, US, and UK. And what we are happy and proud about that K-Bro, they do service not just for hospitality, they're actually treating and cleaning linen for hospitals. So we are getting peace of mind that our linen will be clinically clean. And me, myself, and we actually were invited to see the property and see how it's done. So we actually went there and make sure all the procedures and protocols are followed. So now I can bring this and share with my room attendants, and then they can share it with the guests. So the linen has been hospitally cleaned.
All right. Okay. Thank you. Let me see if there is another question. We still have time. Need to add more trust. Just a minute.
Yeah, for sure. For sure, the trust is needed really, and it starts always with our employee. If we look after employee and then the employee is very happy, then the employee will
That's
look
very
after the
important,
guest,
yes.
and then the guest will come back for sure.
Yeah, it's very important actually. We have to make sure that the staff is, they feel secured before they come into the hotel property. It's not like if
True.
they feel that I go to the like for the hospitals, we really respect. Everybody was, doing stuff for the frontline warriors recently. The clapping were going on and the boards and everything. So it comes to the housekeeping department as well. They should be
But they,
really feeling secured and safe when they enter the hotel property, that they will be, they will not get the virus. So
True,
then
very
once they are safe and they are confident about that, of course they will take care of the guest also.
very
Makes
true.
sense. Yeah.
Vandana,
Yes, Prabhat.
there will be a change in the travel taste also now gradually.
Mm-hmm.
Initially, like the people who are coming to the Middle East and all the business travelers, who
Mm-hmm.
are the average age among 35 to 50 or 60, gradually these people will stop coming that
Mm-hmm.
often, and they will start to send the younger generation to them, 18 to
Interesting.
35.
Mm-hmm.
So because of what will happen is, because
Yeah.
we have 18 to 35 is more vulnerable than these middle-aged or little more senior person. So you
Yeah.
will have the cater differently. Now millennials looking for the different choices than middle-aged business travelers. So those are the things which we have to have keep in mind.
Mm-hmm.
And this will be more demographically change also, which will be coming up in a time, because of right now, as you said, we'll start with the staycations and all. The
Mm-hmm.
first step would be very, very solid step. Everybody, like we are talking about, there will be a room seal. The guest is coming, so that he feel that room is totally fine. And this is something, if you remember, long back used to be a WC band.
Mm-hmm.
But
Yeah.
what if you are putting a WC band, but your WC is not clean?
Mm-hmm.
Someone is coming to a room with a room seal, and he find a stained pillow, or he found a debris on the carpet, and you are talking about you are doing a steam cleaning in a room, so everything goes vain. So you
Mm-hmm.
have to have very, very particular about those things also, on those
Mm-hmm.
norms.
Yeah.
And the people who are coming, because the people who are coming 18 to 35 will reflect the difference in your guest heartbeats or salt or whatever the heartbeats you are talking about on the
Mm-hmm.
social media. So the whole demographic will change now.
Of course, it's not about, it's all consumer market right now. People decide,
Very,
they see the reviews, they see the websites, they go through everything.
very,
I know hotels are trying to target the audience, the consumers directly these days, just to save cost. They don't want to go to booking.com or any other search engine just to save cost, because there is additional cost, of course, because of COVID also. So I think it makes sense. We need to provide the full information on the website, and as the guests come in, we need to make sure that they are safe and secure. They check in safely and they check out safely, so that when they go out, they post on social media, they post their pictures, they say that they were here and they were, the more people will come in then, of course.
we have to build the confidence among the guests
Of
first, that
course.
hotels.
Yeah, that is very, very important right now. Mikhail, Paul, would you like to add something? Tatiana,
Thank you
Yeah,
so
no,
much.
Elena?
very, very, very important, and I'm sure, with all the training materials and with the corporate supports, we will definitely succeed, and hotels will be busy again.
I would like to ask something. What are the new, then comparing with the earlier normal life we had before? What are the new things you guys are adding in your schedule and protocols, like for training, for example? So is there training, especially for the housekeeping department, you have started or you're planning to start,
Yeah.
or the cleaning products you're currently planning to do or already in process? So what are those things,
Yeah,
please, if you
yeah.
can?
We have, for example, tomorrow we have an online seminar for all the housekeeping staff with Diversea.
Mhm.
So they're walking us through the reopening of a hotel. What are the important steps? This is not only the high touch surfaces, but yeah, we are talking about the disinfectants, how they have to be diluted, how they have to be applied, what is the dwell time, and what is the difference between the normal cleaning and disinfecting. Of course, color-coded microfiber and all these kind of things, this all will come up, and yeah, I think that there's a lot to learn still for the room
Yeah,
attendants,
it will be a
because
lot
it's
of learning for sure.
very different, and as what one us had said already, it's not you cannot look at the stopwatch, and say, you have X amount of minutes for a guest room.
Yeah.
The room is clean when it's cleaned, and not when the time is over.
Maybe setting up the steps.
Yeah. So
Yeah. So they have to
Yeah.
finish everything.
Yeah. Maybe credits have to be reduced. We have to
Right.
really look at the time spent guest room to make sure, it is really clean and nothing has been made.
That's wonderful to know. I'm sure everybody has their plans and things in place, and with the new norms, we'll get used to it. And slowly, I would like to invite you all to join hospitality.com also. We have just launched the new portal where you can publish your news announcements, promotions, everything online. And we connect with 1 million professionals. We have been in the market for 12 years. And we connect with 1 million professionals on social media or through other. We connect with 500,000 people as well. So reach is there. So you can start. We are in Canada now. I'm right now in Canada. So now promoting in Canada and US. So hopefully we are building a largest hospitality network in the world. That's what our aim is. So hopefully with the new normal, we are confident, very confident that this thing will come up. Hospitality industry is suffering a little at the moment, but then it'll come back. We all will be together in this for sure.
For sure.
Yeah, so I would like to thank all of you for your time today, and we will be recording we have recorded this. We will be putting this live on our YouTube channel, and we'll be sharing amongst our viewers on YouTube. And we will also be sharing an article with all the insights we have. So yeah, if you have already shared your write-up, please, it's okay. Otherwise, if you have not, please send it to me so that we can cover it up and share the article in the upcoming days. Thank you so much for your time, and stay
Okay.
connected, please. Thank you so much.
Pleasure.
Thank
so
you.
much.
Have a good night. Have a nice day. Bye-bye.
Bye.
Take care. Thank you.
Bye.
Bye.